Hi, everyone, and welcome to Hi-Fi Health News. I'm Erica Grotto. I have something a little different for you today. Recently, I attended the annual conference of the Healthcare Financial Management Association, where I got to talk with some of the movers and shakers in the world of healthcare finance. One of them was Ruth Lande from Undue Medical Debt, an organization that buys patient debt from hospitals and forgives it. Here's what she told me about her work and her best advice for patients. So tell me about Undue Medical Debt from a patient perspective. What's the experience like?
Yeah. So essentially, there's a lot of people out there, whether it's yourself or people in your family, somebody you know who's gone and had some healthcare event, planned, not, whatever, and unable to pay all their bills. And they generally feel really bad about that. Most people really want to pay their bills. They want to be responsible. They're really grateful to healthcare providers for helping them. But sometimes it's so overwhelming and so complex, whether it's your actual pocketbook and what you've got, but also just feeling like, is this right? I don't even understand this. You kind of hide from it, which I totally get.
Yeah.
And so sometimes you've got stuff like that and you don't want to go back for more care. That's the biggest harm, not going back for more care, because you're like, and you might have good insurance or something, but you just don't know because it's so complicated. So really what happens is sometimes you just get a letter in the mail. You don't apply or anything. You get a letter in the mail that says that thing that happened 3 years ago and you didn't pay it all off, it's gone. So stop worrying about it. That's the key. Stop worrying about it. Go seek care and do that. That's what Undue Medical Debt is about. It's all funded by your neighbors, by different philanthropies, and we don't solve the whole system. Let's be really clear. We're one little helping thing.
So for people who are watching, who are thinking about, boy, I need something, I don't know if I'll be able to afford it, what is your biggest piece of advice for folks who are worried about getting the care they need and being able to pay for it, which is probably literally everyone watching?
Everybody. Yeah. I know. And what I say is go get the care. Sure, you try to stay in network if you have insurance, all that kind of in-network stuff, but basically go get the care you need. Don't, stop taking your medications or any of that stuff. And then if you get bills that are weird or large or something, reach out and ask for help from the person who sent you the bill. I feel like there's all this assuming an adversarial relationship, which is really not there. And if you're really shy and if you can't make a phone call, I'm one of those people, get your geeky friend to help you who is sort of annoying, but they like looking at bills. Get their help, whatever. But don't assume that the people who sent you that bill are out to get you.
Yeah, well, I mean, like we always talk about, the system is incredibly complex. As you said, can't solve it today, but there are some things we can do to make it easier. So thanks for sharing some of that.
Oh, you're very welcome.